Hi, I perform hair hygiene. Hi, I'm Kennedi, Baltimore. I'll be your student nurse for today. Today I'll be performing a physical health assessment. Is that okay with you?
Yes.
Okay, I have a well-nourished, well-developed 20-year-old female patient, no acute distress. Can you state your name and date of birth, please?
Kamari Stevens, 21205.
Okay, and can you tell me the year?
2025.
And do you know who the president is?
Donald Trump.
And why are you here?
For a physical.
Okay, so patient is oriented ×4 and their speech is clear and coherent. Okay, so we're just gonna do a few tests on you so far to get started. So the first one we're gonna do is a resistance test. So I'm just gonna put my hand on your cheek and I'm gonna push at it and you just push towards it. Okay, upper side. Okay, and then we're gonna do the same for your head. So, okay, and then can you shirk your shoulders up? Okay, and then okay, put your arms up. Okay, and then all right, and then we're gonna do the same for your legs. So let me push your leg down. Okay. And then you go up over like you just go up towards my leg backwards is toward my hand. Okay. Okay, and then can you press your foot on me at the gas pedal? Okay, thank you. Thank you. Okay. And now we're gonna assess you for your now could you squeeze both of my hands at the same time? Okay, thank you. Okay, now I'm gonna get my pen and we're gonna just test you for soft and sharp sensation. So this is soft, this is sharp, and then this is soft. So you just let me know which one you see. Okay. So can you close your eyes for me? You're gonna do your eyes, so.
What's it, hard or soft?
Yeah.
Hard. That's hard.
Okay. And then we're gonna do a different arm.
So. That's the hard.
Okay.
That's the hard. So.
Okay. So the patient's muscle strength is a 3 out of 5 on a scale of 1 through 5, and it is symmetrical and strong bilaterally on the upper and lower extremities. Okay, and patient sensation is also symmetrical and intact bilaterally, upper and lower extremities. Okay, now we're gonna test your cranial nerves. So first thing we're really gonna do here is just look into your focus. So let me see. Okay. When I see your nose. Okay, can you say ah? Okay. Next, when I come, I'm gonna go behind you and you just tell me how many, like, you can tell me when you see my fingers.
I can see it right now.
Okay.
Yeah,
Okay, so cranial nerve is intact and light where it goes, so. Wait. Okay, that nerve is intact. Okay, and now we check the abducens on number 3 of faculty nerve. So now we're just gonna, can you say a 2-syllable word for me?
Like what?
Like baseball.
Yeah, baseball.
Okay, and can you puff out your cheeks? Can you smile? Can you frown? Okay, thank you. And okay. In this one, we will also do taste, and like we would have them taste something salty or sweet, and they would just say like what they taste, but we're not going to test that right now. And we will also stimulate the corneas with cotton swab or cotton balls. Okay, so the next test we're going to do is the acoustic test. So I'm just going to whisper something in one ear, like you're going to cover this ear and tell me what you hear. So cover this ear for me. Can you tell me what you heard?
Football.
Okay, then we're going to do the same with this ear.
Basketball.
Okay, that's intact. And then can you say I and just touch your finger not to do a gag reflex? And then I. Okay. Work.
Kamari Stevens 21205.
Okay. And then can you stick your tongue out and move it side to side for me? Thank you. And move your head side to side, up and down. Thank you. That nerve is intact. And then there's no hoarseness in the swallow, no hoarseness in the voice. So all 12 cranial nerves are intact. Okay, now we're going to move to the vestibular reflex. So can you just flex your arm for me? Thank you. And then I'm going to arm this, okay? And then, okay. Okay. And then now can you abduct your arm? Thank you. And then I'm just going to do it. Okay, reflex is good. Now can you put your hand under your knee for me? Okay. Okay. And then now we're going to move on to the heel one. So let's see your heel. And just gonna, okay, and can you put your foot up for me? And I'm just gonna check this side of the whiskey test. So I'm just gonna okay. Our DTR, the patients DTR are all intact. And now we're gonna move on to the assess and station gate. So now you're gonna, can I just have you stand up for me? And then can you go a little bit back to that wall? All the way? Well, not all the way. You don't have to. Okay, can you walk up normally for me? And then can you walk back on your heels? Yeah, okay. And then can you walk forward on your toes? Thank you. And then can you walk heel to toe in a straight line? Okay. The patient station is normal and their gait is normal. It's a normal tender gait. Okay, now you can sit back down for me. Okay. Now I'm gonna check the eyes. So I'm gonna check your eyes. Okay, Perla is present. There's no absence or nasal flaring, so I see no nasal flaring. There is no circumferential cyanosis, mucous membranes. There's no pink, or the mucous membranes are pink moist, and there is no pursed lip breathing. So. Okay, so I'm going to assess your neck. Okay. Okay, I see no accessory muscle use. I see no jugular vein distension. I palpated the carotid arteries. I felt no thrills. And I do not resuscitate any carotid bursts. Okay, now we're gonna do inspection of the chest. So, let's see. Okay, the chest is the contour and shape of the chest wall, and it is evaluated. The patient's breathing effort. I saw no visual abnormalities in shape, no barrel chest, no signs of scoliosis, and I noted no visual shortness of breath, no intercostal retractions, no patient tripodal. Okay. Just gonna listen to your lung sounds. I palpate abnormal lung vibrations in either the anterior or posterior lung fields. The lung fields are lateral. A and P, no wheeziness, no rhonchi or crackles noted. I observed no heaves no abnormal heaves over the anterior chest wall. And I palpated no thrills or abnormal vibrations over the vacuolated areas of the heart. Let's see if it's to the heart sounds. Breathing sounds are very clear, no diminishing. There's the right rhythm of the heart rate, and there's a normal regular rhythm, the heartbeat that I tested with the stethoscope. There's a normal capillary refill. Because we're about to test that. Let's see your hands, please. Yes. Okay, there's a normal capillary refill lasting less than 2 seconds on both left and right hand fingers, and it is brisk. Returns, which means it returns in 2 seconds or less. Okay, let me check your arms. Okay, legs. Okay, I do not observe any edema or either the right, left, upper extremities, hands, or lower extremities, or the feet. Okay, now we're gonna check for the temperature. Okay, warm. Next. Okay, the upper and lower extremities are warm to touch. Okay, now we're gonna look at the abdomen. Can I see? Okay. Okay, there's no concave, there's no visible scars. I see no heave, vibrations, or excessively active bowel movements across the abdomen. No bruises. Okay. Now let me listen. Okay, I hear normal bowel sounds across all 4 quadrants. And I do not hear any birds or abnormal blood turbulence or venous humors over the abdomen, aorta, renal, the iliac, or the femoral areas of the abdomen. I did not palpate any areas of the abdomen which are tender, distended. I have not noted any masses with palpation. And I noted normal bowel intonation. Yeah. to the end of my head to toe.